Hi, I'm Charla Johnson, your friendly ENT PA. And we're going to discuss today, what if there's something growing in your mouth? So it's kind of like, hey doc, what's this in my mouth? It could be a mucocele or it could be a fibroma. So if there's some kind of weird bump in your mouth, the question is it soft and squishy, or is it hard and firm, kind of like a pebble? So we're going to break down the difference between a mucocele and a fibroma. These two things tend to freak people out when they find out that there's something growing in their mouth. A lot of times it's painless. You don't even know it's there. The only reason you find out about it is because your dentist happens to see it on your annual or biannual checkup. They're totally harmless, but we're going to get into it and distinguish between a mucocele versus a fibroma. So let's start out with a mucocele. Those are fluid-filled sacs that will grow usually on the lip. They can get on the cheek. You can see them under the tongue, rarely on the tongue, but they can occur there. What they are is salivary glands that have been backed up, and it will cause swelling because it's filled with saliva. It happens if you tend to bite your lip, or there's some trauma to your lip, like you were hit in the mouth with a ball or something like that. A softball bounces off of second base and hits you in the mouth. Usually they're on the lower lip, but they can be on the upper lip. They tend to be clear or bluish in tint. They're very soft and squishy, kind of like a water balloon. The good news is they're totally benign. They're not going to cause cancer. Small ones can tend to go away on their own, maybe in a few days, a couple of weeks. However, larger ones, or if you keep traumatizing the same area, they get bigger. They will swell up, and you will have to have them surgically removed. And I'll show you that later on. It's a simple removal. Now let's talk about fibromas. So fibromas are usually from chronic irritation. That's because you keep biting your lip or cheek. You have braces that rub up against the inside of your lower lip or your cheek. You have a sharp tooth that tends to keep grinding or biting into the sides of your lip. At nighttime, you may bite or pinch your pinch your mucosal lining with your teeth. These things may go away on their own also, but most of the time they have to be surgically removed. So who can take these out? I'm glad you asked. A dentist can take them out. But normally, if a dentist takes them out, it's not going to be covered by the insurance. Most people's insurance, dental insurance, covers minor things like cleanings, some radiographic pictures of the mouth, teeth, but it doesn't usually cover a lot of surgical intervention. If it does, you probably have to pay a lot. With your insurance, you can be covered if you go see an ENT, and they will cover most of the cost because they send it to your insurance. And it's sent off to pathology for them to find out if it is benign or cancerous. We take it off and send it there just for assurance. Now, the fast breakdown, quickie breakdown on this is mucoceles are soft, usually bluish in tint, fluid filled, and they'll go away on their own. Fibromas are firm, pink or white, fibrous looking, and they usually have to be removed. Both of them are benign and both of them are pretty easy to treat. So we would just have to inject with some lidocaine to numb it all up. And then that's the most painful part is when you have the injection. Afterwards, we usually take a punch biopsy like you see here. That's that round circular metal thing that we would press firmly in the area. And then we use a pickup and we take a scissor and cut under there to remove all of that tissue. And then it's sent off to pathology for evaluation. You'll get the answer anywhere from 7 to 10 days. Your provider will tell you. So once it's taken out, it's either sutured, where we will put sutures in, like you see here, or we will use silver nitrate if it's a smaller area where we can cauterize the vessels so that it doesn't continue to bleed. So post-op treatment for that is you make sure that you're not eating anything or drinking anything really hot within 3 hours so that there's not any excessive bleeding. We want you to not eat any, which all of this stuff that I'm getting ready to tell you makes total common sense. Citric juices you don't want to drink because that citric, that acid, would really irritate an open wound. Salty foods, high salt foods, you don't want to do that because it would burn that area. Putting salt in a wound is painful. We all know that. And if you have spicy foods, that would cause irritation, may cause it to bleed. So you don't want to do those things within the 3 to 5 days that it takes for the area to heal up. But once it heals up, you're all fine. You'll have nice, smooth, pink tissue in the mouth with no other problems. If you are having any growths or lumps in your mouth that you see, go and see your friendly ENT. You may have your dentist direct you to an ENT because once they tell you the cost of that biopsy, you'll come see us. I have no doubt.
Stop.
For more information on any of this that we spoke about on today, you can follow me on my YouTube channel at Body, the letter N, Balance 25. Body in Balance 25. See you soon.